Namaste, myself I am Dr. Rajiv Raj and today we are going to see the chapter of Prameha in Ayurveda. So in the chapter of Prameha we can include diabetes type 1, type 2 and other kind of diabetes. It is the first time in Ayurveda Nidana, especially the Prameha Nidana, that Ayurveda speaks about the immunity of human body. इह खलु निधान दोष दूष्य विशेषेभ्यो विकाराणाम विघात भावा भाव प्रतिविशेषा भवन्ति. The meaning is like that. There is the presence of a bhava, the presence of a factor which is against the disease, and there is the absence of a factor which is fighting against the disease. So the presence of a factor which is fighting against the disease is what we call as immunity in Ayurveda, and the absence of the same is the lack of immunity in Ayurveda. When we discuss about the etiology of the Prameha, we have to understand that Ayurveda says that Asya Sugham Sopna Sugham Dedini Gramyodaganubharasam Bayamsi Navannapanam Gudavaikritam Cha Prameha Hedur Khabakrisra Sarvam. Asya Sugham. The food that we are taking should not be excessive nourishing in type or kabha increasing in type. Sopna Sugham. We should not go for excessive sleep or divasopna, day sleeping should be avoided. Dedini, we should not take the curd inside. Over consumption of the curd is not indicated in Ayurveda. Gramya udaga anuparasa, that means the meat of the aquatic animals like the fish and also the marshy animals should not be consumed, and excessive intake of milk is also contraindicated. So we need to understand that we need to avoid the nidana or the etiological factors, and that is what we call as nidana parivarjanam in Ayurveda, which is the first form of treatment approach towards curing the diabetes in Ayurveda. Now we see that how we are going to manage the patients in Ayurveda. Especially the diabetic patients are classified into two types. One is the Stula Pramehi, another one is the Krisha Pramehi. The Stula Pramehi is the category of patients who is obese and energetic and having good bala of the body. Whereas the Krisha Pramehi is those who are lean and having less bala of the body and also emaciated, we can say. So Stula Pramehi Balavanihega Krishastadega Paridurbalascha Santarpanam or Sambrahmanam Tasya Krishasya Karim Samshodanam Dosha Baladigasya. So the Stula Pramehi we have to go for Samshodana Chikilsa. Samshodana Chikilsa means Panchakarma. And for the Krisha Pramehi we have to go for the Sandarpana Chikilsa. Samshodana Ulleghana Lenghanani Kala Prayuktani Khabha Pramehi. For the Khabha Pramehi we go for the Vamana kind of treatment. Nyeya Pitta Prabhavan Vireka. For Pitta kind of Pramehi we have to go for the Virechana, and then Samshamana should be given. And for the Krisha Pramehi, Sandarpana Chikilsa should be given. So Acharya say that Snigdhasya yoga vivida prayujya kalpobadishta malashodhanaya. So for the malashodhana purpose, there are many kind of snigdha yogas told in the Kalpasthana of Charaka Samhita. Urdham cha adaha male abanide meheshu sandarpanameva garyam. So in order to do the mala abharanam urdha bhagam, that is vamanam, mala abharanam adho bhagam, that is virejanam, snigdha yoga is told in the Kalpasthana of Charaka Samhita, that should be given in the case of Stula Pramehi who is Balavan. Whereas the Krisha Pramehi we have to go for Santarpanam eva karyam or Sambrahmanam eva karyam. Always nourishing substance should be given for the Krisha Pramehi. So Acharya says that the Krisha Pramehi should be always given Santarpana Chikilsa. Samshodanam na arhayadi yaha Pramehi tasya kriya Samshamanam Prayujya. Like that it is told. Mandha Kashaya Evachurna Lehya Prameha Shandir Lighvascha Bhakshya. So no way Apadarpana Chikilsa or Lenghana Chikilsa should be given for any Prameha Rogis. Always Sandarpana Chikilsa should be given. By understanding all these factors, we have to approach the patients in Ayurveda And when we treat for such prameha, as per the Acharya's description, all the associated symptoms like diabetic retinopathy, burning sensation in the body, diabetic neuropathy, diabetic nephropathy, or whatever associated symptoms or upadrava vyadis which the person is having will also come down with this kind of treatment. So, meet you with another topic next day. Thank you one and all.